So today, there is the will at CHAM is to really look at facts and solutions concerning a theme. How can we counteract antisocial behavior or incivility of healthcare consumers? So we connect these two, consumers and also antisocial behavior. And so this week, this is connected to the dissatisfaction and satisfaction of unlimited needs. So when we talk about antisocial behavior or incivility, in fact, I'm going to give you a definition which is given by an American sociologist, Richard, who is saying that antisocial behavior is the activity that protects myself vis-a-vis others, and it enables me to really be in the company of others. It preserves the other from the weight of myself. I'm not going to enter in details, but what is interesting here is behind this definition, there's a notion of distance, the right distance amongst oneself and your different impulses, your desires, etc., vis-a-vis others. So the question I'm going to be raising to my different guests, and one of them will be on the video. You see, Mr. TERRENOIR, can you tell us what are all these different antisocial behaviors or incivilities? Because you're in charge of this Monitoring Center for Violence. Hello to everyone. Yes. You can see this mountain decoration, so I can be linked to you. So these kinds of antisocial behavior from our different monitoring center for violence in the health center. In 2005, we defined this after we had this particularly violent, with the assassination of a nurse and the health assistant, and violence had already started in the health sector before. And amongst these different violence acts, you have different, they're different to really define, even amongst the penal law. Now, we're talking about all these kinds of behaviors that are antisocial, where people feeling that they want to be served immediately, they want right away to have what they want, to go ahead of others. They don't have any of this normal social behavior. It's not necessarily severe violence or physically to be aggressing someone, but it could be behaviors, not respecting rules, rudeness, trying to jump in the line, and then it could degenerate with very negative speaking, and then it can even be at a more serious level, and really come into a violent act. It's very difficult to really define, because I give you an example. So the neighbor who is walking with her high heels, and then the dog is barking. No, if someone feels that they are doing within their rights, and so this issue is something that raises the question of how can we resolve this noise, which is disturbing this different services, and it also has an effect on those that are testimony to this situation. Now, can you tell us the context that these violence incidents, are there different conditions that favor these populations that are more easily the target of these violences? Can you give us more information? For me, in fact, in this framework of this violence that we have in our all the different establishments in the DGOS that we have been spoken about, we have 4 different levels. So you have physical and verbal ones. So you have these insults, you have the threats, and then you go into more of physical aggression, violent act. The analysis that I can do for some years now, I've categorized, but it's not particularly ideal. But we do have these 4 categories. We have persons who, because of their marginal behaviors, maybe they're drug addicts, alcoholics, people that have psychiatric disorders. So you have different kinds of violence related to these issues. But then other kinds of violence you find in all professions, not only in the health sector, and these are related to sectors that really serve people. In other words, you have the violence. So you have Mr. Lambda person, and it was perhaps not revealed, these kinds of violences 25 years ago, but anyone, all of a sudden, because they're frustrated, and then I often find this in the different signs, maybe they do not support, or that they are told no, like a little toddler of 3 years. Is pulling a tantrum. So then you have this different unbalanced force strength relationship. And so what's happening, they're going beyond the civic behavior, and this can lead to penal sanctions. There are persons that have a psychological problem, people that can be in a nursing home, for example, called an EHPAD in France. And so these people, the victim can be shocked, but they cannot explain their behavior, because in this kind of a situation, you have a person who in fact does not has some problems, different intellectual problems, but that's not all that's not the kind of things we're interested in. Now, this violence, this affects in the priority, I believe, the person, the healthcare persons vis-a-vis the doctors, because so very broadly, it really affects 74%, if my figures are exact, it really affects more women, because most of these kinds of staff at that level that are not doctors are really affected by this antisocial behavior. And it's not just by chance, I would say. Yes, there is a feminization of the healthcare sector, especially the nurses and healthcare assistants, so women are more affected. But it's true that for me, it's 40% amongst the healthcare professionals. It's 80% of this that are 84%. Yes, they are the nurses and the healthcare assistants. So so people have issues with the healthcare assistants. You also have a phenomenon which is you hear about in the media when you have these serious situations in the emergency wards and also in psychiatric units that really makes a big impression on people in general. So the most important point is to have this verbal aggression. In fact, people, because of the effect of alcohol, or they have anxiety crisis, and then it leads to physical violence. So, in fact, the person will be verbally contesting, and then it can go to another level. And I would like to say, Mr. TERRENOIR, we do not have a good connection. I suggest now that we go to your colleague, Éric REVUE, who he is also in the front lines because he is a man, he is a doctor. But perhaps, Éric, you can describe to us how it happens in a Parisian hospital, which is well situated as the Lariboisière hospital, which is near the Gare du Nord, near the shooting unit for migrants, etc. You have really yes, of course, we are known for that. We're not very proud of that situation. We don't have a choice, though, because this hospital called Lariboisière, in these emergency situations, we have a big concentration of population in the 19th and this nearby area. So we have all these people, migrants, people that have different psychological problems. We have this other addictions. We, in our emergency ward, this is the most unsafe private part of the hospital. We are very, very much exposed. And as you said in the observatory, those, unfortunately, these are the nurses and the healthcare assistants. What now is, this is becoming trivial of not only just verbal aggressions, which is, you see this on a daily basis with the insults, but also physical aggressions. So a nurse that is actually really has someone that comes in with a knife, this is not, this happens. And so how can this be explained? Well, even in 1 year ago, our smear team was going to handle a very important case, and because they were blocked the streets, and you had some delinquents that came and started aggressing the team. And of course, the reflection was to call the police, who arrived on the scene right away. But this they're making this violence very trivial. When we talk with the police officers, they are saying, yes, we're used to being insulted. Well, that's not really normal. But we spoke to the fireman. He said, yes, it's becoming more commonplace. And also the emergency unit saying they are there for the patients, and that's why they had to block the road. And then they were attacked by this group band. And so, as we're saying, you have this situation, you have the anxiety, of course you have pain, and so our work is to really handle that. We're not good if we don't handle that early. And then if you add to that those patients that are alcoholics and psychiatric issues, and then you have the McDonald drive, I want things right away, that kind of an approach. So you put this with what I call this, you have this emergency ward, which is really hot, and it's like a pressure cooker. You have people that are waiting, and so they start influencing the others in the waiting room negatively. As we're saying in the preparation, you're at this hospital, Lariboisière, you have a concentration at night, and less staff at night, and then the conditions are perfect for this pressure cooker exploding. And yes, it's more dangerous at night. The night staff are in that situation because you have more alcohol problems at night, and also the anxiety is really more intense at night, and you have less staff. So this situation we have to adapt our protocol, not only in the daytime, but also at night with these procedures. We'll be talking more about them later, so that we can really handle this situation, because this violence is occurring. I was talking about alcohol, but the worst of the worst of the time at this hospital. Well, what is the date? What is the date? It's the worst date. No, it's called the Fête de la Musique, a musical event. Everyone is drunk that day. We have all these alcoholics. Instead of 40, we have 100 patients. They're all full of alcohol. I thought that music had a good influence on people's moods. No, not for this special musical festivity. So you were saying it's also the case of the monitoring center. And so these institutions are no longer sanctuaries. They are completely exposed to violence. But we, the officers, and also liberals, how do they handle this? Yes, we also are very much exposed, because we are the door there. Anybody can come in, says Gilles BONNEFOND, who is the Union of Pharmacists representative. So these figures that you have are really underestimated. So the case also it's the case for the monitoring center as well. So we feel that the sampling was representative, but we do have the figures are underestimated. Well, in fact, you can sometimes have a staff can have a knife under their throat just to get a medicine. So this is going on. It's not really easy to handle in the pharmacies. So a person who would like to have a treatment, in fact, if we don't give him this treatment, then so what happens? He's going to attack the door. He said, "I'm not going to leave the pharmacy until you don't give me my therapy." He doesn't have a prescription, and we said we can't do anything. You have to go first see the doctor. We say this lasts 2 hours, and we ask him to leave, and so then you have a fight even in the street. So it's not easy to handle these kinds of situations. And the whole street knows about this fight that is on the sidewalk in front of the pharmacy. So then you have already, for 1 year, you said, Okay. So there's going to, for example, schizophrenic women, there's verbal aggression, yes. And so we spent 2 weeks retrieving this person so that this patient no longer comes to this pharmacy. Now, COVID also had an impact. That created tension. We recall there was this distancing, and in fact, there were people that were spitting. But thank goodness we have this plexiglass. But it's very violent when they're just spitting at you. And I'm not talking about thefts or classical kinds of deterioration. So the situation is there. If you don't have a prescription, you have not seen your doctor, I cannot give you medicine. So this is a blocked situation where you have to explain things. Of course, the different, we have young people that come, they're trying to get medicine so they can make special cocktails with alcohol. You have to know how to tell them no. You have to know how to really ensure that this doesn't turn into a violent situation. Once again, you have to explain. You say you suspect. You say no, it's not me. It's not easy to handle these situations. And of course, you have this issue with the when you have stock that's not available. Say, how come you don't have this medicine in stock? And so the last point, which is the most important one, is that you have the doctors that are not available. If they're not available, I need my medicine. I go to the pharmacy cannot do everything. So we're blocked very, very quickly. This is what happens, and things are not getting better because I want right away, and I'm used to getting things right away, and I want the pharmacist to give it to me, give me this medicine right away. However, we are not that kind of a service, self ones. Now, of course, when you have this, not an observative, but this landscape and this situation is becoming increasing. You have documentation of this reality, which affects all the different professions. It's the same for community doctors as also in cabinets. So, Danielle, you have the difficult task of representing patients and telling us, because from the side of the patients, how can where do these antisocial behaviors exist? Are they at the side of the patients, but also healthcare professionals? Well, yes, of course, you have antisocial behaviors. Incivilities is not something new. We've known about this for some time ago. This goes back. In fact, you have a lot of hear about this in the news, and it's in this kind of antisocial behavior is increasing, as we all see. The pharmacists and everyone we see, there's an evolving society. Our society is becoming less patient, and it's becoming more impatient is how I want to put it. Our society is becoming impatient, less tolerant also. Each one wants everything right away. As you have said, unfortunately, we cannot have everything right away. Now, from the point of view of the patients, we, in our associations, we are softer than what you experience. We have feedback from the patients who have aggressive behavior, particularly violent ones, violent acts, and these kinds of behaviors that are violent are because of this the certification of public services, for example, and that has an effect on access to healthcare. The first point that really affects them is making appointments. These are very concrete points. It's making appointments. You already have to find a doctor that accepts you. Now, it's not just doctors, because you have a different therapist as well. Everyone's concerned. When the patient, the one is going to become a patient, because then you need to you make this appointment first. So you call to make an appointment. So we don't take any new patients. Unfortunately, we are full. We cannot take any new patients. So when you have different automatic responses like this, and you finally get an appointment, the appointment is really far away. And so, and also the place that this appointment is located is also far from where you live. So we have these appointments not at the hour that are really easy for you. So we have to work things out so we can have our children be taken care of, get a babysitter when we have an appointment, et cetera, et cetera. And when the day of the consultation comes and you have to wait for 1 hour because there aren't enough healthcare staff, so that's why you have to have these long waiting times. And so all of this this is really for the serious case. For us, for chronic patients, we have less problem appointments because they are scheduled. However, where you have an issue is when all of a sudden you have a serious situation for a chronic illness, and this is then very, very difficult to make the appointment. And we are not able to then fit in this appointment. You have to fight to then get this appointment. It's even more full of anxiety because a chronic illness is when you have a treatment that cannot be interrupted. So if you have a delay in the appointment, that really causes a lot of anxiety amongst patients. And it could also have consequences. And in fact, this can explain a form of violence, says the moderator. So these 27 million that we've heard about these cases, 27 million of non-respected consultations. Well, yes, in fact, this is really horrible because it's not good for the patients not to meet the appointments. It's hard to get these appointments. And so when the Parisian area studies that done a survey concerning the doctors in the Paris area, they said there are 2 doctors. In fact, what I want to say, the doctors in the day, they have at least 2 appointments that where they failed to come. So this is enormous, all these appointments where people fail to show up. And so we see this is really occurring. The healthcare assistants do not have the capacity to absorb all these needs of patients without any doubt, as it's difficult for them to get an appointment. So what do? What they do is they do overbooking. So they'll call 3 different doctors to get an overbooking. So that's what we do, and we see until social behavior because of this. We have to also say that the patient can also have a feeling of frustration, which makes them nervous if they don't obtain, after their consultation, the answers to their expectations. So the healthcare staff, if they don't listen to the patient, then that's an issue. Yes, it's important for the healthcare staff to be more efficient, to prepare the appointments. Now, if it's in this CHAM wants us to go through local concrete situations, what can we do, Gilles Bonfond, when we have all these different, we see this different situation, video surveillance cameras, all pharmacies have them, but they're not very useful. It's really afterwards that these surveillance cameras are useful, but many of the patients that are aggressive are known by the pharmacists themselves. Yes, half of those who actually do the incidents are known. Yes, video surveillance cameras, well, yes, some people even have security guards, but I believe that's not at really the core of the matter. What are the factors of tension should be viewed, and how can we reduce them? It's important to recall that the pharmacy is really a healthcare area. It's not a good. It's not a consumption area. No, we actually have to reinforce the pharmacy and the healthcare relationship. When you have these prescriptions, prescriptions made under certain conditions, and the patient should understand well that this is to have an efficacious or efficient approach. So this is the perception that is important for them to understand. Another point is that we do have a lot of patients, as we were saying earlier, that have different insufficient, actually they have difficulties because they're toxicon drug issues. So every month they go to their doctor to get their prescription. There's not a reevaluation of their situation. Is that legitimate to do that? To complicate things for these unstable, have an unstable situation for this one? We renewed this treatment because we didn't have enough consultations, and we were not in capacity to, people were not able to have meetings. But what are the conditions when a patient is not stable? How can we increase and extend the prescription? Yes, so you can have, what we're saying, you can have some flexibility in certain cases to control, of course. You don't do this for all the patients. Yes, now we also have the situation when a patient cannot have their chronic treatment, And in that case, we can extend, we can ensure the continuity of the treatment for 1 month. We should be able to do this, but undertaking all the responsible measures. I know this patient. I know he's been taking this treatment for a long time. He could not get his appointment. I can ensure the continuity of his treatment because, say, the patient, if you have to say, no, I can't give it to you, but the doctor's not there, so you have to go just to the emergency department of the hospital to renew your prescription. That doesn't mean a good organization of the different healthcare resources. There are other points that are really stupid, which is the complexity of regulations for prescriptions. Today, you have 50 different situations to take drugs where certain conditions for prescriptions, and this is not more than 3 months, is not more than 6 months. We need to simplify because the patient, in fact, does not understand why we have these regulations. He needs this medicine. And with the public authorities, can't we just simplify the prescription rules and different waivers? And so we have to all really improve the access to healthcare. This is really what causes the problem today. In fact, I couldn't get my prescription. I couldn't make the appointment to see the doctor, so I go see the pharmacist. And so you have to do something, because otherwise the situation of attention. So in the emergency wards, you all know that when a person has been waiting 5 hours or more at the emergency department, and then they go to the pharmacy, then they really feel very tense. So we have to think of these different kinds of waiver situations. Now, Éric, for the emergency department, you've set up some measures. You were thinking of other measures that could be generous. Yes, we have several measures so we could adapt to the population of the patients who are coming. There are some people that do not need to come to the emergency department. They come just for a prescription. We are not there to actually deliver prescriptions. That's not our work. We have set up a consultation with different healthcare centers, just vis-a-vis the emergency department. We have to give an answer to our patients. We don't want them to wait 5 hours for a prescription. So we set up this special organization, and the patients are satisfied with it. This is good for those who can pay, but unfortunately, those who don't have any healthcare insurance, we have a special pass. So for those who can do this, but unfortunately, to go back concerning the violent practice, we have different security guards at the door of the emergency department. We also have a metallic door because we've had a lot of knives that have been coming through. So this is not inviolable because we even found some issues because it was for those patients who are valid who go through this revolving door. And there were people that are coming in the ambulance and they couldn't come through. And one day we had a patient who had a knife in his pocket, and he was coming in with through the emergency room that way. And so we have names alerts in different departments. So you have 10 persons who are coming, and this is really dissuasive. So for a patient, psychiatric, or the one who has drunk, you have 10 people close to you, and you can really fight with them. But you see 10 people, maybe 10 young women facing you. It's dissuasive. So we worked with this special psychiatric unit, and which in the worst situation, but we have to do this, which is a special physical, chemical measures, which really are only for a small percentage of the population to use those kinds of methods. And because we have nurses that are most exposed, we encourage them to systematically make a complaint. And I also encourage people at the hospitals to make a complaint when there's an incident, because we don't have enough of the actually reporting on these kinds of aggressions. And this is not only in France, in all the countries of the world, there's not enough of these kinds of complaints made. We have to encourage them to do this. We have to protect these nursing and health staff. We actually have to have legal proceedings for those who actually undertake these violent acts. We've also had different persons sent to prison because of their violent acts. Now, where we have to improve at the level of the emergency ward is to really handle the waiting time. Because if someone waits 5, 6, 8 hours in the emergency ward, well, then we have to communicate with the patients. We have to explain to them why they're waiting. And when you say and it's kind of idiot. But when I'm really taking care of someone more serious, then it's important for them to understand. So we need to communicate. We need to communicate with the patients. We say, okay, it's not normal to wait if we don't communicate with them. And also for people that are attending their different persons that are ill, we have to improve in this area. We really have to improve this healthcare. Another point, in fact, in the Île-de-France, Greater Paris, this is very Parisian, I'm going to say in the Île-de-France, Paris region, in real time, the waiting time for children and for adults. In fact, I check this often, more, in fact, by professionalism more than anything else. It's important to say that sometimes what happens, we have a choice between 2 or 2 hours 10, but we don't have any solutions. So it says 20 minutes. We don't cheat on these kinds of data. We can say hello. We don't say the application of emergency gives the rate of activity so people know about and if it says 20 minutes and it's really longer, well, that's an issue. But if we compare with what happens in the US, because money is there, so they say, come, you have 5 minutes waiting time, so that's how they do it. They can, because it can be connected to money issues, and so that is recorded like that in the US. Okay, Danielle VACHER, what should we do for these different French advocacy associations like yours for the patients? Well, in fact, there are some solutions which are in 2 different areas for the different healthcare personnel. So it's important to have a holistic approach. Now, for training of students in the healthcare area, we do have patients that intervene. Either these are patients who actually are for the control group, so they're teachers that come. They're different from the schools of nursing schools or therapy schools to really become more increased knowledge of our different pathological conditions. There are different university hospitals that also have programs to increase the patient and the healthcare staff relationship, and so you have different communication, so you can see, they can understand then what are the different things that have to be avoided in this relationship. We cannot intervene as association, but what we could, there are some training necessary for the administrators, which is very important for those who take the appointments, and they're the ones who are taking up all these, they're getting all these insults, they're on the front lines. Train them to handle their emotions, to really take a situation and calm it down so that it does not become conflictual. And so good psychology is needed in that case. So I'm going to interrupt. I'm really sorry. So Vincent TERRENOIR, is your connection better? So what are the solutions you would be proposing in the different reports? Yes. Can you hear me? Very good. I believe that what we've heard from the other panelists, I believe training against a different aggression, verbal and physical aggression is important. You're talking about how to really calm down the situation. That's very important. And that enables, in particular, for the healthcare assistants to really handle better other violent incidents that can occur. When I look at the different training sessions at different hospitals, there is feedback that, in fact, it was very interesting. And so training of healthcare staff is very important, and better communication, because if you have bad communication that can generate violence. Yes, Mr. TERRENOIR, can you give us a word of conclusion? Because unfortunately, we have to all come up with a conclusion. We only have some 40 seconds. I believe, yes, you need a range of tools to help really this healthcare staff react when you have antisocial behavior. So then we have all this range, and we can then select the best one. So yes, BONNEFOND, Mr. BONNEFOND, yes, to have continuity of health care, then you have to have support to really cope with these kinds of crisis situations. You need to reinforce the doctor-pharmacist relationship. It's important to have consistency between them. Éric, it's not a fatality. I believe that we have to fight against this. We need to organize, we need to adapt, anticipate, and train. And Danielle, yes, your empathy from everyone for the different healthcare assistants and also all the staff. And so behind all the medical staff, there is a human being, and also the patients are human beings. Thank you very much. Thank you.